I've been married to Miguel for 14 years. We're really adventurous. We like to do a lot of things outdoors.
For us, family is important.
Together, we have about 33 nephews and nieces.
Children love her. She's really great with kids.
You know, you dream when you get married, you're gonna have kids. About a year after we got married, we decided to have a baby. Our first pregnancy, the doctor did an ultrasound and they didn't have a heartbeat. They told me that I had a molar pregnancy. Every time I have tried to become pregnant, I have had a molar pregnancy. I have seen 4 doctors. It's been 14 years and I have 5 molar pregnancies. My last molar pregnancy was so severe that I had to go through chemo.
I almost lost my wife. After the 5th time, the doctor said that she probably could conceive through IVF and genetic screenings.
The last doctor suggested to select a male embryo so that we'll have a higher chance to have a successful pregnancy.
There's 3 rooms in this house. We always envisioned that we would fill one of those with a baby. I still remember the very first time when I went to the store and I bought baby shoes.
We have kept this as a symbol of hope. After 14 years, we still have them.
She would make a wonderful mom, and I just wish that dream would come true.
Lily and Miguel join us. Thanks for being here. We're also joined by IVF fertility expert, Dr. Scott Sills. First, I want to thank both of you just for being so open about this. I know it's a very personal struggle, one you've been dealing with for so very long, and Lily has suffered from something known as molar pregnancies. Dr. Ashton, will you just quickly explain to folks what that is?
Basically, this is an abnormal growth that occurs in the setting of pregnancy, thought to involve the placental cells. Sometimes it coincides with the presence of a fetus. Sometimes there is no fetus. It's just this growth of cells. It's pretty uncommon. Most of the time it's benign, but it can actually be malignant, and as we heard for you, Lily, require chemotherapy. It's under the broader category called GTD, or gestational trophoblastic disease, and a lot of times we pick this up on ultrasound, just routine ultrasound. Patient will come into our office, say they got a positive pregnancy test. We follow blood levels. We keep looking by sonogram, and instead of seeing a heartbeat or a fetus, we see things that look like grapes. And then, with a series of other tests, usually make the diagnosis, but it can be really, really difficult physically and emotionally.
And Dr. Sills, your specialty is working with people who are struggling to get pregnant. I know you examined both Lily and Miguel, tested them. What did you find? What is their issue in your mind?
Well, exact cause for this problem is still a mystery. We know that it occurs maybe in 1 out of 1,500 pregnancies, 1 in 1,000, so it's pretty uncommon. But physically, both patients are in excellent health. There's no blood test you can take to predict this. It's a genetic accident that happens. But if we can get an embryo that has the normal balance of chromosomes and select that embryo for transfer, that could make the problem of molar pregnancy go away.
And I know that Dr. Sills has talked with both of you. Is this something that you two are interested in exploring?
Yes, definitely.
Definitely, yes.
Well, I just sitting here watching the 2 of you hold hands, I can see you two as parents, and Dr. Sills happens to be the type of individual that can help.
Well, it's a lot of cooks in the kitchen to make this happen. But all of the colleagues that are working together would like to make this treatment for you at no cost.
Wow. What are you feeling, Lilia?
Yeah. Okay. I don't know. Just, thank you. Thank you so much. It's since this has been so long, it's almost unreal.
Well, thank you for sharing your story. And a lot of people are providing services to make this happen. We'd like to thank all of them. Fulgent Diagnostics for performing the genetic sequence analysis. Our friends at the Center for Advanced Genetics for donating the IVF. And thanks to Ovigen for performing the PGS tests and embryology services. And finally, Newport Beach Surgery Center for donating anesthesia services as well as the operating facilities.